So what what is it like? You said now that you're on the other side, and I believe this week, which is incredible. Congratulations. I think you shared with me you're going back into clinical practice, and that's awesome. And I'm sure you're looking forward to it on some level. What um, what is the perspective that you have as a physician as you head into, first of all, you've had this period of time where you haven't been working clinically, and you've gone through a really difficult time, and now you're on the other side of it. You had a complication. Sort of moving forward, what how is it affecting you as a doctor, if it is? Does it you think it's changing your approach to how you think about patient care?
Oh, 100%.
Really?
Definitely. This has made me rethink everything involved in the patient-doctor relationship. Yeah, for sure. When I get that call after hours, I now know that there's a patient on the other side who's scared. And they may have a complication that I could have glossed over or didn't mention, and they need that clarified. And so rather than poo-pooing it and saying, why didn't you call during office hours? Or why are you calling at 5:15? And now my answering service is involved. That's not the case anymore. I'm certainly nervous, but I think it'll be like riding a bicycle. I've staggered my schedule, so it's not going to be significantly overwhelming like the old days were. And it's just a matter of, I got to get back out there. I got to rip the Band-Aid off. I got to do what I'm trained to do. And with time, I'm hoping to get some normalcy. But again, it's normalcy with a different perspective, a new perspective, something that I think is better, potentially will be more thorough, and develop a deeper relationship with the patients that I see.
Hmm. How about a perspective about your own health? Obviously, this is incredibly jarring, almost like everything is fine and then you're shaken, and now you're on the other side of being shaken, and um, it's almost like a new lease in life. And thank God, we're living in 2026. That you were able to find out this issue, you were able to have surgery and have it repaired and lead a normal life moving forward. Has it also changed the way that you perhaps want to live your life moving forward? Let's take medicine aside. How you want to be a dad, how you want to be a husband, how you want to change your diet or your exercise or your own health. Has there been any introspection around that?
Yes. And I've done that from day one of my post-op recovery. I've looked in the mirror and I've told myself that you can't live the way that you've lived. You have to be fortunate. And this is my second chance. This was found with me alive versus the contrary. And I'm running with that. And so, yeah, diet has changed, portion control, healthier food, lifestyle changes. What do I mean by that? I want to be in the moment. I know it sounds cliche, but frequently as physicians, we're present physically in one area, but we're thinking about the third patient that we saw in the morning, the two cases that I did that I'm worried about the outcome. Meanwhile, I'm on the sideline of my son's baseball game. I need to be in that moment. Obviously, we're all professional. We have that responsibility that we have to maintain, but I want to live in the moment. And I think that means setting up proper boundaries and finding yourself in the right zone at the right time. There will be a time where you have to focus on your physician occupation. And then there will be times when you have to focus on your family. I think you need to limit the distractions when you're in one versus the other. Family should be priority. And I will admit it probably wasn't always my priority. But now that I have this new outlook, this second chance, that is going to be a priority. And I have team members that are holding me accountable. I have family members that are holding me accountable. And with that comes my own responsibility, not only being a physician, but being a grown adult, recognizing that exercise is super important. I've been walking. I'm not running yet for obvious reasons, but walking, increasing my step count, etc. That's all my way of giving back to myself with this second chance.